Semaglutide, sold under the brand name Ozempic, is a glucagon-like peptide 1 analog, originally approved to reduce major adverse cardiovascular events in patients with type 2 diabetes mellitus. However, one of its side effects, weight loss, has made it incredibly popular as a treatment for obesity, which led to a dramatic increase in off-label use.
In response, a separate weight loss product released under the brand name Wegovy has been approved in the US, UK, EU, and Japan with restrictions based on BMI and the presence of obesity-related comorbidities. The FDA has also recently approved Wegovy for treatment of metabolic-associated split hepatitis or MASH, a serious liver disease linked to cirrhosis and liver cancer.
The drug is delivered via weekly subcutaneous self-injections into the abdomen, thigh, or upper arm at gradually increasing dosage until reaching the target dose of 2.4 mg. The half-life of semaglutide is approximately 1 week, and steady-state exposure is usually achieved after 4 to 5 weeks.
In the STOP clinical trial, patients experienced an average weight loss of 15% after 6-8 weeks, accompanied by a reduction in cardiometabolic risk factors. The most common adverse effect is nausea, affecting nearly half of patients.
Other side effects include vomiting, abdominal pain, constipation, and diarrhea, leading in extreme cases to acute kidney injury due to dehydration. Other potential risks include pancreatitis, biliary tract disorders, diabetic retinopathy, and thyroid C-cell tumors.
Semaglutide is effective for weight loss in part because insulin resistance, inflammation, and oxidative stress are implicated in both obesity and type 2 diabetes mellitus. Enteroendocrine L cells in the ileum and colon secrete GLP-1, which binds to GLP-1 receptors in the pancreas, enhancing insulin selection from beta cells while suppressing glucagon release from alpha cells.
GLP-1 and its analog semaglutide slow gastric emptying and promote the filling of satiety within the hypothalamus, leading to weight loss through reduced caloric intake. Semaglutide ameliorates insulin resistance by upregulating the expression of glucose transporter type 4 in skeletal muscle and adipose tissue.
Semaglutide also promotes adipose tissue browning, in which fine adipose tissue is converted into beige adipose tissue, with thermogenic properties similar to brown adipose tissue. Beige adipose tissue has a larger number of mitochondria and expresses uncoupling protein 1, or UCP1.
UCP1 opens a channel through the mitochondrial membrane that allows protons to bypass ATP synthase, generating heat instead of ATP. Semaglutide also exerts anti-inflammatory effects and reduces the activity of macrophages in adipose tissue.
Despite 94% homology with GLP-1, semaglutide contains two modifications that greatly extend its half-life.
The first modification blocks degradation by dipeptide peptidase 4, while the second modification allows semaglutide to bind to albumin, slowing its clearance in the kidney.
Sometimes dismissed as a vanity drug for celebrities, semaglutide is a potentially life-saving medication, although its popularity and effectiveness have limited availability and increased price, pushing it out of reach for many.